Hi, I'm Emma.
And I'm Helena, and we both work at the MS Trust. Just a little disclaimer, we're still recording this over Zoom because of coronavirus and social distancing, so apologies if it sounds iffy at any stage. Please do bear with us.
Welcome to our series of podcasts in which our volunteer Will of Ask the Expert podcast fame goes behind the scenes at the MS Trust. He'll be interviewing some of the teams who provide the useful information, resources and support to people with multiple sclerosis every day.
And because Will is a volunteer with MS himself, he'll be asking some of those questions that maybe you always have been wondering but never had the chance to ask.
Today, Will will be chatting to Simon and Janice from the information team. The information team are basically our in-house team of MS experts. They're the people who deal with all things MS, from answering inquiries from people affected by MS to writing content for our website and even producing our publications, such as the ones you might receive from your health professional when you're first diagnosed. They also do a whole lot of other things, and I'm sure they're going to tell you about some of those in their interview.
The information team, which I'm also a part of, is pretty much the core of what we're working on here at the MS Trust. So I'm pretty excited to hear about what they have to say.
Today it's my great pleasure to be joined by Janice and Simon, who are both members of the MS Trust information team. Janice, welcome.
Thank you very much.
Simon, welcome. It's the first time having two guests on the podcast. I'm very, very excited. Now, Janice specializes in research, and you'll notice the MS Trust will publish this little digest of research studies. You can go into, at the very top, click latest, and then latest research. And Simon handles the information team, which I can't remember the number, but we'll mention it at the end. But it's one of the avenues on which we answer questions. So, first question. How long have you been working for the MS Trust, and what do you? I've kind of talked about what you do there, but perhaps you could tell us a bit more about this. Let's start with you, Janice.
Yep. Okay. So I've been with the MS Trust for 15 years, and over that time, I've been a member of the information team, and I've worked on a number of different projects, a number of different publications that we've produced in the past. I think the Kids Guide to MS was one of the ones that I worked on early on. Also MS Decisions, I worked on that as well with other members of that team. But more recently, I've become sort of looking particularly at, as you mentioned earlier on in your introduction, looking at research publications, what new information, what new research is coming out, being published in the medical literature, and I produce the research update, which, as you say, you can sign up for, and you can read the research updates on our website. So that's quite that's a part of my job, which takes quite a lot of time. Mm-hmm. There's an awful lot of work being published in the field of MS, but it's very interesting and lots of new things coming through.
How about yourself, Simon? So I'm told that as long as Janice's tenure seems, you're actually the father of the trust, the father of the house, the oldest serving MS Trust employee. Is that right?
Probably longest serving rather than oldest.
Oh, my bad.
But I'm probably pushing that one as well a bit. Yeah. No, I've been at the trust since the end of 2000, so just over 20 years now. And when I joined, I was the second member of the information team. That was the entirety of the team, and over the intervening years we've sort of filled in and built up the numbers. And as Janice said, I've also worked on earlier versions of some of the publications that we've developed, and in the last 5-6 years I've focused on looking after the inquiry team and coordinating the team, both answering calls and inquiries myself, and also sort of coordinating the team so that we've got somebody on the phone or answering.
Because you're staffing this line weekdays, I think 9 to 5.
Yeah, within
office hours. Yeah, it's a full time job, effectively.
Oh, entirely. Yes, and the majority of the team have got other tasks as well. So Janice on the research side, and other people sort of developing the content as well. So making sure that we've got people available to answer people's inquiries is challenging in its own way. Developing a rota for that.
So when I spoke to David Martin, the CEO of the MS Trust, he stressed the information mission of the MS Trust, especially in comparison to another larger orange-themed MS charity that shan't be named here, which is the big one. The MS Trust being more the boutique one, and it's like the best. It's a very good way to lead to better outcome and make a difference with small means, because you can't sponsor a whole bunch of very expensive stuff, but like getting the information to circulate across all of those mediums. So take us through this. There's the information line. I forgot about all of the paper publication that the Trust puts out. Janice, you mentioned the research updates, which is a mailing list you can sign up to and get, I think, monthly or so aggregation with bullet points of what's been cool in the MS research space. What else is there? I'm going to throw this to Simon first. Sorry.
Yeah, well, the website, which of course is probably our hugest publication, really. A vast amount of information there. And then also the newsletters, the mailings, as well as the research update. There is a news mail.
And so the inquiry line, Simon, how many calls do you get a week on average? Or is that too difficult to tell?
It's about 300 to 350 a month. So that comes down around sort of 70, 80 or so.
Wow, okay. So it's 10 a day, yeah. And so what
10, 20 or so, yeah. Quite, yeah.
And are there trends within the inquiry? What's the typical, I mean, if there is a typical, what are the nature of the inquiries?
It's completely across the board. We can get calls from everybody, from the person who has unusual symptoms and has gone online and bumped into the word MS and is concerned they might have MS, through to people who've had the condition for many years and have a lot of experience of MS and a knowledge of MS, but have come across a particular problem that's causing them issues. Probably questions about symptoms and diagnosis are probably the things that happen most often, but when the phone rings, you never know what's going to be the question.
Well, interestingly, this mirrors the unpredictability of MS itself, which is, I think, perhaps as a patient, I think it's one of the most distressing aspects of the disease, that you don't really know, what exactly is going to happen, and every time something new crops up, it can be worrying. So it's nice to have those reassuring voices and knowledgeable people you can go to get some info. Janice, how about the sort of what in terms of research? Because you've been there a while, so have you seen trends and or in the patient, the interest of the patients and.
Yeah, I mean, I think over the years I've been looking at the research. There have been trends. Things have come and gone. I do remember when I started working at the MS Trust, one of the key concerns was something called neutralizing antibodies, which was potentially a problem if you were taking one of the self-injected disease-modifying drugs. The neutralizing antibodies was a kind of your body's reaction to the drugs, and there was a concern that they might reduce the efficacy of the treatment. I mean, that one that's turned out to be less of a concern, and through the years that one's don't see much coming through on that. Obviously, quite recently, there's been a huge volume of research on COVID and the potential impact of COVID on people with MS, how it might, how one of the disease-modifying drugs might affect your resistance to COVID, or how they might affect vaccination. So there's a huge amount of research coming through on that now. And I guess, I think one of the areas of research that's becoming quite exciting now is the potential to improve the remyelination, putting back myelin onto the nerve fibers after there's been damage. And there's quite a lot of research going on there, and looking perhaps more at progressive MS. Less of the attention has always been on relapsing remitting MS, but there's more research now coming through for progressive MS. The other trend that I'm seeing too, which I find very encouraging, is now with a growing number of years of experience for people taking disease modifying drugs, we're beginning to see the impact that has on your your future MS, and seeing that people are living longer without disability if they can start a disease modifying drug early on after diagnosis, they have a longer period of time without disability, or there is definite strong evidence now that starting treatments early, starting more effective treatments means you do have better future outcomes.
And another part of your job is to translate all of the recommendations coming from the National Institute for, is it still Clinical Excellence? I think their acronym is still NICE, although it might be different words, which are the guidelines for treatment on the NHS in Britain. Could you tell us a bit more about that?
Yeah, sure. So what I do as well, I track new drugs as they're going through their clinical trials.
Mm-hmm.
And we have information on those new drugs on the website. People can follow that through the drugs in development section of the website. So I'm sort of seeing them coming through all the different sort of formal stages of testing. And once they've got through and showed the drugs have been shown to be effective, the pharmaceutical company will apply for a license so they can actually market the drug. Now they do that here in the UK through the MHRA. But after that, the drug has to go to NICE for England to be reviewed for cost effectiveness, if you like, to make sure that it's the drug is effective enough and it gives value for money for the NHS, basically. So NICE look at that for England and Wales, and Scotland. In Scotland, it's the Scottish Medicines Consortium.
Right.
So we get involved with the appraisals, what they were called appraisals, where they're reviewing the drugs for NICE and also for SMC, the Scottish Medicines Consortium. And I put together our submission, making a strong case for why a particular new drug will be effective. And part of that involves talking to people with MS, people who perhaps have taken one of the other disease-modifying drugs, which haven't always worked as well as they could, maybe don't, for a variety of reasons, perhaps effectiveness, perhaps the way you take it, or the tests that you have to have regularly to make sure the drug is safe. So I'm talking to people with MS, putting their experience together and putting it into the report that I send through to NICE. And then getting involved at a later stage, perhaps when they've made a decision which perhaps isn't something we would necessarily be happy about, and we would try and argue the case for making that drug available.
So that's one of the other roles of the MS Trust that we may not be quite as familiar, is that you're effectively doing patient advocacy. You're collating all of the voice of the patient to try and get change to happen, because approval, as in it's okay, we've deemed that it's effective and you can market it as a medicine, is not quite there in terms of patient access, because then that makes it available for private prescription. But in practice, for the vast majority of the patient, it's really about, is it available on the NHS? And so that's NICE, and that's the SMB. And for that, and we see, like in the research updates, you see, there's every now and then there's like this particular one didn't get its NICE approval. Everyone's very disappointed. We're still fighting for it. Or like some stuff gets approved in Scotland and not in England. And that's something that's always weird for like the, so-called United Kingdom, that ultimately there's a bit of a postcode lottery in your treatment. We've touched on COVID a little bit, but I wonder if we could delve a little bit deeper in that. We're recording this in August of 2021 when, of course, it's all blown over by now, right? Maybe not. So, Simon, on your side, presumably there's been more inquiries about this on the line.
Yes, certainly back in March 2020, when the pandemic sort of first really hit, we pretty much had 2 months worth of inquiries in a month. We had a huge number of calls, because information was so hard to come by, really, and nobody was quite sure what the restrictions were, what the implications were for people with MS, the impact of the various medications they were taking on risk from the infection. And it was a huge team effort, both sort of dealing with that volume of inquiries coming in and also developing content primarily on the website, so that people had a source of reliable information to sort of try and navigate them through very strange waters indeed.
Yeah, and I remember I think it was around March, April of 2020 when the MS Trust started putting a dedicated page for COVID and MS that was updated very regularly and would aggregate all of the available research. And I'm assuming, Janice, that's you I need to thank about this, because then I went to look it up and I was like, I specifically wanted to find out whether any research was done about my DMD, Ocrevus. And of course, back at the time, effectively was just a case study. It's not really there's no sample, it's a sample size of one. But it's I think that's important. That feeds into COVID is a prime example of how the mission of information of the MS Trust is not one way, because what comes from the inquiry line, you take the temperature of the patient, you know what they want to know, and then this feeds into all of the publication, the research updates, and so on. How about you, Janice? Any particular takeaways on COVID? Do you think we have a better picture now than we did, say, a year ago?
I think there's still a lot of questions, aren't there? And I think for people with MS, but also for the general public, I think there's still a lot of uncertainty generally about how the future will work out. I think it's much clearer now, what the risks are for people with MS, and that who is more at risk. And again, are probably very similar picture to the general population, if you like. The certain age is a factor, and other health conditions can reduce your ability to your risk of having severe COVID. We certainly have a better idea now about vaccination, but again, I think it's still early days, and we're there seem to be we're not sure how long you'll be protected by your vaccination. And I think one set of questions perhaps gets answered, but another set of questions comes through.
That's right. One answer brings another 5 questions.
Exactly.
Exponential. That's the only another exponential growth thing.
Yeah.
Do any of you have a personal connection to MS? I know that often you come to. How did you come to join the trust? Let's start with Simon, who's the oldest serving, second member of the information team.
I did have a friend who had been diagnosed a few years before I joined the trust, which possibly sort of made me aware of MS as a condition, though to be honest, it was sort of finding a job rather than sort of following MS that brought me to the trust. I had background in information work anyway, and had worked in other charities, and this job was appealing, but I think I was probably sort of slightly more aware of MS by having come across it in my own life, though I wasn't on a mission to solve MS.
But did your work at the MS Trust change the image you had of MS? I mean, especially since the disease was certainly because of the treatments have evolved so much over the past 20 years that you. How was your journey on that front? Oh,
entirely. I sort of arrived with a vague knowledge of MS, which I suppose sort of kind of reflects people who are diagnosed as well. I mean, and the general population knowledge of MS is, people might know the name, but sort of not really know what it means. But yes, it's sort of, you quickly realise the complexity and the variety and the unknownness of so much of MS, and as it leads you through the labyrinth. And the last 20 years has seen a huge change in the MS spectrum.
Absolutely. I mean, and the disease hasn't changed. It's just the way we treat it and the outcomes. But this is what makes it, I think, back, I want to say 20th century MS was, I mean, as much as we could deplore the lack of effective treatments, if anything, that lack of treatment meant that the prognosis could at least be asserted because we had a view of what was going on. Whereas now, if you're on a treatment that was only approved 5 years ago, it's going to be difficult to figure out what's the prognosis to 30 years. And by the time 25 years later, it's been 30 years, there's going to be another dozen treatments that have come. So in the 21st century, it's a completely different animal. How about you? So how about you, Janice? Do you have a personal connection? What took you to apply to the MS Trust and to stay there?
I don't have a direct personal connection with MS. No, I've had a very close family member who had a long-term chronic neurological disorder. So I saw for myself, how that can, take a lot from somebody's life and make it very difficult. And I've also, like Simon, I worked in the information world for a long time. First of all, in a sort of scientific setting, but also working with a software company. So getting sort of going out and meeting other information teams, if you like, and getting a stronger feel of how information works in all sorts of different industries, from oil industry through to, I don't know, I can't think of anything. Yeah, it's, some big sort of multinational organizations through to one-man bands where, developing an information resource was their business. So very interesting, and, got a whole broad range of information from how information works in different organizations that way. And then, always been interested in health and health-related issues. So the opportunity to go and work for the MS Trust and because it was a small organization too, I think that's something that, through my working life, I found I really enjoyed working in a smaller organization where I felt that I could, have a more direct effect on how things work, how the organization managed to achieve its goals, if you like. So I think that's one of the things I really do appreciate about the MS Trust is we are a small organisation. We do an awful lot. I think we punch we punch well above our weight, if you like, given our organisation size. But the organisation size means that I can easily talk to other members of the organisation, and we all share ideas and have an input to where we're going.
Absolutely, and indeed, if your job is information, getting everything circulating and everyone communicating with each other is paramount. And of course, absolutely. Like the larger the organization, the trickier that is. I was told, Simon, that you've written books. So your information background, you're sort of downplaying your information background. I was told you have a librarian background. I don't know if it was metaphorical or literal.
No, it is very literal. I started in public libraries and
back when they existed, were open, right?
Yes. Back when the world was black and white, or at least sepia, and worked through public libraries for quite a number of years, and then moved into information work within charities, and that brought me to the trust ultimately. Yes. The books I've written were within the MS Trust. I mean, there's some of our publications, some of which are still around in future.
Well, I've got some of them in my target.
Yes.
Janice, what's exciting in the research space these days? I was in the latest news. I mean, at the time of recording, of course, there's a really good article about consideration about accessing stem cell therapy on the NHS with NICE. I myself am about to try low-dose naloxone. I was talking to my neurologist just yesterday, and she was like, "Oh, you can only get it privately out of pocket." So I'm like, "Well, if it's not too expensive, I'll give it a shot." And so I'm always interested in those. I mean, every time there's a new DMD. I think every time or something that is not a traditional immunosuppressant DMD, but another way to approach the problem, I'm really, really interested. Yeah, well, you're at the front line of this, Janice. What's cool? Like, what's going on at the moment?
I think, there's quite a lot of new clinical trials or studies taking place, and some of them, very early on in the process, trying out different targets, if you like. So, different ways of tackling, because ultimately, we still really don't understand the biology of MS. We know that there's a number of different ways we can hit it, and it's finding those different targets. So I think there are a number of new things coming through. You might have heard about Bruton kinase, tyrosine kinase, BTK inhibitors. that seems like an interesting new angle.
And that's completely new to it, right? That's so unique so far, the sole drug that uses that mechanism of action. Yeah.
And I think there's a number of the pharmaceutical companies are developing drugs with that, from that group of, that class of MS drugs. And it'll be interesting to see, how they work out. As I think I mentioned earlier on, I think there's quite a lot of work being done now looking at remyelination, and again, different ways of targeting that, different ways of helping repair the myelin that's been damaged in MS, and possibly making, doing that in combination with other treatments. I think, I think probably the way the future is rather than taking a single drug, you will end up taking multiple, a combination of drugs which tackle different things. Some are doing the repair work, some are preventing future changes. And I think, it'll be a balance of the different drugs that will work.
Do you think that within the next, say, call it 10, because it's been moving so fast, right? Within the next 10 years, do you think we'll see something like specifically targeting and achieving remyelination, hopefully approved on the NHS, which is the crucial part?
Yeah, I think there's a good chance. I mean, I don't like to make any predictions of this sort because it is so early on. It is. I think there's always a risk of saying we'll have a cure in 10 years. And
when the stem cell stuff came about, right, 5 years ago, it was like, that's it, we have finally a cure. And then, of course, the people who had the treatment, it came back and like, oh, okay, that's just another type of treatment, not exactly a cure.
Yeah. I think people who have, and I think part of the problem, I think, with some of the clinical trials is that they run for 2 years. And you don't know how people will do in 5 years, 10 years. And I think, so I think you always have to be a little bit cautious at the beginning. You have to sort of be prepared to, you've got to wait and see how it works out longer term for people. And it's, so you have to be a little bit, possibly a little kind of cautious about, making predictions as to how things will work out until you've got that sort of length of time. And you can see, somebody who took this early on in their MS, they've had it, they've been taking it sort of more or less continuously for the last 10 years. They're now doing, how are they doing now? It's at that point that you can start to think, well, actually, yes, it is really having a benefit.
Yeah, I mean, it is I think MS, I mean, all of those long-term diseases that have like a long-term evolution that are very challenging because the pace of the disease is what drives how you run your study, because you want to look at the long-term prognosis. Whereas the pace of drug development is obviously to try to go to market as fast as possible. I mean, if we find that like Oak Rivers 20 years down the line gets you to sprout wings, I guess I'm in for a surprise in a bit. Yeah, it's what that kind of thing.
Yeah, absolutely.
All right, our final question on which we try and end every interview. What is your one piece of advice for someone recently diagnosed with MS? Janice?
Oh, I think I would probably say take your time. Don't feel, be kind to yourself. Just sort of sit back and think about it a little bit. If you've got somebody you're close to that you feel comfortable with, open up the lines of communication, talk to them, find somebody you can, speak to about any concerns you might have. Probably stick to some very basic information to start with. Don't kind of throw yourself into it. Some people are that way inclined. Other people kind of feel like they want to let the information sink in before they kind of explore what it really means. And I think, understand that MS is a very variable condition too. So what somebody might tell you about their experience or somebody they knew may have, not have any real relevant, may not apply to yourself. So you always have to take things, with a pinch of salt, and think, well, that's possible, but I have to think about, this is me, I'm going to be slightly different. So I think, you have to kind of take your time, kind of find your way through it.
Yeah, it's going to be with you for a while, so, no need to rush.
Exactly.
I think I would encourage people to if not necessarily seek out information, know where the information is that they can seek out. Everybody will have different needs at time of diagnosis. Some people want to know everything, some people want to keep it at arm's length, but knowing where reliable sources of information are, for instance, the MS Trust and the other MS charities, and knowing where to turn to when they need to turn to for information is important. If you don't have information, you can sort of fill in all the dark spaces with
absolutely
with dark
knowledge
thoughts.
is power, famously.
Entirely, yes. It doesn't mean that you have to know everything on day one, but if you know where you can turn when you need it, then that safety net is there to help you through.
Excellent. Well, thank you very much to the both of you for your time. Simon, Janice, thanks a lot, and keep up the good work.
You're very welcome.
Thank you.
Now, if this was a commercial podcast, here is where there would be an advert. But as we're a charity, we don't do that. So instead, we'd like to take this opportunity to tell you all about our fantastic resources for people with MS.
Our website, which is mstrust.org.uk, has tons of information and resources for people affected by MS. And of course, today we have to mention the information resources. There's information for the not yet diagnosed, newly diagnosed, and for people at all stages of their MS. Just head to mstrust.org.uk, hit the menu where it says About MS or Life with MS, and you'll find the information just there. And we're back.
Always interesting to hear these behind the scenes type chats, because obviously, and it's a bit strange with this one because it's my team, the one that I work with, but obviously I think it's still interesting to sort of hear the background stories of Simon and Janice and how they ended up where they did.
Yeah, like you say, it's unusual because we work with Simon and Janice quite closely most days, but yeah, it's just really nice because at the MS Trust, Simon and Janice are just sort of fonts of information on everything MS related, and they've been with the Trust for quite a while now, as Will obviously spoke about in their interview. So, it's really good to speak to some people who have that knowledge.
Well, and because both Simon and Janice are, like myself, kind of part of the furniture at the MS Trust, because we've all been here for quite a long time, I feel like, there's so much stuff that they do know. I know, for instance, when I was thinking of signing up for a research trial that I was in on a few years ago, I was talking a lot to Janice, what she thought and what research was like and all that sort of things. And of course, I'm privileged to be able to do that because we're not in the same office at the moment, but that we used to be in the same office. But at the same time, you can always call up and chat to the inquiry people if you have any kind of question. So even though I do feel very privileged, you could have that privilege too if you give us a call.
Yeah, of course. Will obviously asked Janice a little bit about some of the research updates that she does, and I know she works very closely with some of the boards that sort of sign off some of the new DMDs, and she sort of firsthand finds out about what's coming up in the world of MS. And I know that on our website and social media channels, some of those new research pieces are quite popular. So it's really nice to hear from Janice on that aspect.
And I think, I've been working as a part of the information team since 2016. I'm more on the periphery because I'm more helping out with sending some of these questions that we get from social media. Well, actually, you do too, don't you, Emma, even if you work in a different team from me. And it's so busy. So aside from all the sort of research and the DMD things that we mentioned, all these questions that we keep on getting, so many people that want to know things, and it's not just phone and email, but social media as well. I think on average, the info team answer around 350 inquiries a month. And if you're curious about some of the topics that were sort of asked most about last month, I just had to find out for this podcast. And last month it was things that were relating to mobility issues, pain, and people who were recently diagnosed. And it was in fact our busiest December ever. Oh yeah, and here's a fun stat. If you like statistics. December was the first month that saw more podcast downloads than orders from publications. So that's one for us to be proud of, Emma.
Oh, wow. I didn't even know that myself. That's really interesting, actually.
Yeah, and I suppose more and more people do online things and listen to things and read things online, watch videos and things rather than reading things. But if you go to our website and look for resources, you'll find links to our shops there which has got all the publications. And I say shop, but they don't cost anything. They're all free. You can download them, or you can actually send after some of them, as well as physical books and paper.
Yeah, definitely. I think that's one of the brilliant things about the Trust. We've got options for everyone. If you're not a fan of reading or you prefer to take in your information in a different way, there's obviously this podcast, there's videos on YouTube, and lots of different ways to get that information.
Definitely something for everyone, I think.
So if you'd like to know more about the work that the MS Trust does, including what the information team do, visit mstrust.org.uk and click on the What We Do tab.
And so then, as we've mentioned a few times now, if you have any questions about MS, we're here for you. Our inquiry services are available from Monday to Friday, except UK bank holidays, from 9 a.m. to 5 p.m. And outside of these hours, you can leave us a message and we'll get back to you as soon as we can. You can call our inquiry service on 0800 032 38 39, or you can email us on ask@mstrust.org.uk.
You can also find us on Facebook, YouTube, Twitter and Instagram. And you can find this podcast on Spotify, Google and Apple Podcasts, as well as Amazon Music. Get in touch if there are any topics you'd like to hear more about in the future. And of course, don't forget to give us a like and a subscribe.
And we'd also like to say a big thank you to Anne Chapman Audio for the music of the podcast. And of course to Will, Janice and Simon for the involvement in this podcast.